Good afternoon, everyone. It's a great honor to be here today. Like Dr. Armstrong introduced, my name is NyoThet San. I'm a recent graduate. I graduated with a nutrition degree from Bournemouth University. At the moment, I'm doing voluntary nutrition research in Eastleigh for improving malnutrition within the older people. So today I'm going to talk about my chronic kidney disease called lupus nephritis. My primary diagnosis was SLE, which is lupus. It's an autoimmune disease that affects parts of the body. What it really does is it attacks your own body cells thinking it's foreign cells. So your immune system is really overactive and you become unwell because of that. It's a non-curable disease, but symptoms can improve if treated early. And the treatments are mainly immunosuppressive, being it overly active, and inflammatory treatments to reduce the inflammation within the organs and tissues. Symptoms varies greatly from patient to patient. It can depend on age, what your diet is like, and what your genetic background is, and so on. And I was first diagnosed with lupus when I was 14 years old. I'm now 26 years old, so it's been quite a while that I've been living with lupus. At first, I didn't really take it seriously. I just take it as normal illness during my young age. But it became more obvious as I grow older. When I start going to college and university, it started having big effect on me because it really restricts what I want to do for my daily life. After being diagnosed with lupus, after a few months, I was admitted to pediatric intensive care because the condition was really serious. And I was in there for a month, and I woke up after a month feeling like it was yesterday that I was admitted to hospital. And I remember trying to get out from the bed, but I couldn't. I just dropped back down on the bed because I've been on the bed for a month with no movement at all. But I just couldn't believe it. And it was like having another new life again because I had to learn how to walk again. And I was fed with tube feeding for a month, so I couldn't go straight back onto the normal oral diet. So I was on tube feeding for the first few days after I become conscious again. And I had to get quite a lot of therapy to be able to swallow and eat solid food again gradually. So that's my primary diagnosis, lupus. And as it being systemic lupus, it can affect all the tissues and organs of the body. And lupus affect up to kidney is affected most in lupus patient, and there is up to 50% kidney involvement in lupus overall. And when it starts affecting kidney, it's irreversible loss onto kidney function. So it doesn't completely go away, but then the treatment for lupus nephritis is to prevent any further damage to kidney so that I don't have to get kidney transplant at all in the future. So I was diagnosed, after having diagnosed with lupus at 14, I keep getting flare up every now and then, every 3 months. So I was always poorly most of the time. And actually, I was diagnosed with lupus when I got my GCSE results. And when I go back to college, I had no confidence at all because of all these medication I had to go through. And I just feel like I was not me when I started college. So first year of college was totally rubbish for me because I couldn't make friends, because I was lack of confidence, and also because my college was quite close to my house. So I'll go back home every now and then to take a break from all these exhausting lectures and take a rest back home. So I didn't have much time to spend time with friends and make friends. So it was quite a difficult first year. So I decided to do my first year again during my college, but it improved. It got better because I'm starting to adjust my life with lupus by then. But because my lupus wasn't very under control, it kept flaring up again and again. So it goes on throughout my college years, and I've finished my college in 2012, and I started applying for uni. At that time, my ambition was to study medicine, but I wasn't really realistic at the time. I still applied for medicine for my university, but then after I submitted my uni application, I was diagnosed, I had neutropenia, which means I had very low white blood cell, and I'm very immune. I'm very immunosuppressed, and so I was admitted to hospital for a while, and it was there where I was doing my uni application again, because then by that time I realized that I need to be realistic with what I was doing, and so I applied medicine and diet and nutrition both. So I decided to concentrate on just doing nutrition degree, and because of my health, I couldn't achieve the grades I wanted to get into the university I've applied for. So I remember applying for university again through clearing from university bed. It was quite an experience because I was wearing my patient gown and there was no internet access within the hospital. So I'll go up to the nurse and said, look, I really need to do this. There's a deadline. I need to get into uni. So I'll said that to one of the nurses, and she was kind enough to let me use one of her computer to let me go through all those clearing processes. So I was sat there at the nurse station with my gown, with my IV dripping, and one of the patients passed by and he was looking at me, what the hell is she doing here? What is she doing? So, but I was just concentrating on applying for my uni. So finally I got to clearing to Bournemouth University. I chose it also because it was close to Southampton. I knew that I couldn't go farther from Southampton because of my health condition. I need to go back and forth for my appointments, as well as whenever I'm unwell, I can't be too far away from my family. So I got to uni with the lupus. I got to uni. I wasn't kidney wasn't affected very badly back then. But it was during my second year, it started affecting really badly. When I went to see my lupus consultant, he started noticing blood in my urine and protein in my urine, so he became a bit concerned, and we started concentrating on these symptoms. And after a while, it kept getting worse, so I was referred to Dr. Armstrong to get checked up with my kidneys, and at first we just kept it under control with the medications, with the blood pressure tablets, and with I always kept under control with blood pressure tablets throughout those periods, but then it just wasn't under control. My blood pressure kept going up every time I go into clinic to see Dr. Armstrong. So Dr. Armstrong decided to do kidney biopsy. So we did that, and the results came out, and it turns out that I had lupus nephritis. And within lupus nephritis, there are 5 stages in total. And as I have shown, 1 and 2 early stages, 4 to 5 are terminal stages, where this is where you need transplant. Kidney transplant, but mine was stage 3. It's not too early, it's not the transplant stage, but it's quite in the middle still. It's going towards the side of transplant. So by that time, I was very poorly. My main symptoms were high blood pressure, edema. Those were the main things I suffered the most. My weight gone up for like 10 kg within a few months because of all the waters within my body. And it just keep happening. And one day I woke up from my sleep. I felt so weird. I was like, I'm not feeling all right. I got up and looked up in the mirror. I saw myself. I didn't believe that it was me because I looked so different. And I have taken a picture of some of my puffy faces, water faces, but this is the worst, as you can see. That one was my worst. I couldn't recognize myself looking back in the mirror, and I feel just so heavy overall. As you can see, my hand was all bloated, my face was bloated, my tummy was bloated, my leg was everywhere on my body was bloated. It feels very heavy to even walk. And I was tired all the time, and I gained so much water weight on my body that I couldn't fit into my clothes anymore. So I went 2 sizes up. I started wearing my mom's clothes. So I couldn't be bothered buying new clothes at all. So I was like, Mom, can I borrow your clothes? And she was happy enough to borrow me some of her clothes. So for those few months, I was just wearing my mom's clothes. It was okay, it was quite comfy. I still go to my uni, but I was absent for quite a lot of my lectures. But again, my uni was very supportive throughout my uni years. They know that I have this condition, and they were really supportive. If I weren't able to attend the lectures, they will send someone to take notes for me, or my friends, they will record the lectures for me, so I wasn't missing out. But I wasn't physically there, but I was able to continue with my studies. So the third picture is when I got plasma exchange treatment, because it wasn't, my lupus nephritis was getting too bad, and it wasn't improving at all with the antihypertensive tablets and diuretics. So we finally decided to go with plasma exchange procedure, and it was done in Portsmouth Hospital. So what it does is I had a neckline put in here, and that machine is where they circulate all the plasma through and go through my neckline. So that process takes a whole day. I have to travel from Southampton 5 in the morning because the hospital transport would come and collect me 5 in the morning. And I got to the hospital, get ready, and then from about 8 a.m., all the plasma, frozen plasma, will get delivered to the ward, and they start putting it in the machine. And I will be lied on the bed for up until like 3 p.m., no moving at all, because it has to go continuously. And I remember I had to make sure that I don't drink too much before I had the plasma exchange, otherwise I'll be so much in trouble. And because like the plasma exchange, they came straight out from the fridge, so they were really cold as well. So when I'm receiving the treatment, I have so many blankets all over my body. It was so cold, so I always make sure I don't drink lots of water. Oh yeah, one thing I wanted to mention was when I was having all these water weight on my body, it was very difficult because I feel so heavy and I don't want to go anywhere. And the other thing was eating, my diet. Because of the water, it feels so full. Even though I'm hungry, I don't feel like I want to eat, because as soon as I eat, it becomes heavier. So I would rather not eat. I just lay down and have a few sips of water. And there was a day where I remember when I had only 1 strawberry the whole day because I was that full. I didn't want to eat any food at all, even though I was hungry. I was hungry, I want to eat, but it was so full, I would rather stay without eating any food at all. On top of this plasma exchange treatment, I was also receiving biological treatment called rituximab. So at the time, a lot of treatment was going on. I was receiving rituximab, I was receiving plasma exchange, I had received cyclophosphamide as well, and I'm on several other medications like steroids, antihypertensive tablets, and other immunosuppressive tablets. So all these medications were making me really tired and fatigued. That it was already my third year, I should be concentrating on my dissertation, finishing it up. But because of all these, I couldn't do that. And my lecturer suggested that maybe I should take a year out from doing my studies during my second year. But I insisted on going on and doing it. I just said, I'll just take things slowly, but I'll just keep on going because I wanted to get this degree. And I kept myself positive, and even though all these treatments were going on, I just talked to myself, I'm lucky enough to get all these treatments. Without these treatments, I won't even be able to study at all, so I kept myself positive throughout the treatments. And my family was really supportive as well. My mom was always there when I go to hospital in Postma to receive treatment. She will always make all these packed lunch ready and from everything ready for me to take and go. So I received all the support I needed throughout these treatments. And even though I was very persistent, health always comes first, so I decided to during my third year, I was supposed to hand in my dissertation, but I couldn't because of all these treatments. So I decided to, instead of just getting a degree without honors, I requested them to extend my submission deadline slightly further so that I can submit next year. That was a hard decision for me to make as well, because that means I couldn't graduate with all my classmates, because they'll be graduating in 2015, but because I haven't handed in my dissertation yet, I'll be graduating a year later. That stopped me from making that decision for a while. I thought, no, I wanted to graduate with all my classmates. I don't want to be on my own. I want to celebrate it with my friends. I was quite persistent about it, but then at the end, I accepted my situation. So I said, okay, I won't do my dissertation during my third year, but I referred to next year, April. So that's when that's why my degree got extended a year further to do the dissertation. And at the end, I was able to complete my dissertation, and I finally graduated in 2016 with my nutrition degree with second honors. So that was one of my biggest achievement. It looks nothing. If you think back about it, it doesn't look much, but what I had to go through, it was quite a lot during the short period of time, but I had to stay positive all the time because I have this future I have to go on to. So to manage lupus nephritis, I started to restrict my intake of protein and salt. It's a really big part of lupus nephritis, because that's why if I eat quite a lot of protein and salt, it will keep passing through urine and it will put more workload on my kidneys. So to prevent that, I keep my intake of protein quite low. And salt intake as well, it can increase my blood pressure. So I'm really careful about my salt intake. If I go out to eat takeaway food and I realize that I have had quite a lot of salt intake for the day, I'll try to reduce it down by drinking quite a lot of water throughout the day. And regular monitoring of blood pressure is another important part of managing lupus nephritis as well, because I need to be able to see my trend of how well controlled my blood pressure is. So, yep, that's the end of my presentation, and I'd like to thank you all for listening. And today being World Women's Day as well, I would like to request the audience to give a big round of applause to Dr. Armstrong and my mom back there for being great support throughout my years.
Again, I think this is a truly, truly inspirational talk. I'm quite moved by it because I've had the pleasure of looking after this young lady for several years, and I remember having great concerns about her health at one stage. But the one thing that has always struck me is her absolute dedication to her studies and her determination to get her degree. And she has worked exceptionally hard to get to where she's got to. And she absolutely has had the support of her mum, who's at the back of the audience. So it was a really, really good talk. And, you know, it is a really complex condition to live with. And, you know, this is a condition that NyoThet still has and is still receiving active treatment for. And, you know, she knows as well as we do that the future is uncertain. But we live for today and we do what we can. And she's made amazing progress in the last few years. And you know, getting a degree with a second-class honours at the end of a very, very difficult time of her life, I think, is an achievement to be proud of. So well done. Has anybody got any questions that they would like to direct this way? Now's your opportunity. There we go. At this stage, it's not necessary. So NyoThet's kidney function is not bad enough to require a transplant, and that's obviously something that she will be under long-term follow-up. But we hope that with good blood pressure management and attention to the healthy lifestyle and maintaining the immunosuppression treatment, that we can preserve her kidney function for a very long time.
Yeah, because, you know, you said that you've been doing this for so long, you know, you struggle to study, you know, it's easier to just have a transplant because we saw the case when
Of course, but transplants are not without their complications, and we've seen someone who's done incredibly well from a transplant. As we said right at the start, they're a very scarce resource. We don't have enough, and the criteria for going onto the transplant list is that your EGFR, your percentage function, must be 15 or less. You can't go onto the transplant waiting list if it's higher than that. So NyoThet doesn't currently need or qualify for a kidney transplant.
We actually had that discussion during one of our outpatient clinic, and my mum and my sister, they're just ready to give their kidney for me. They're like, have it, you can give it to her, we're ready to give it to her. But like Dr. Armstrong explained, you can't just have it when you don't need it.
Sorry, talking about transplant, so if you were to have a transplant, would the lupus still affect it?
No, because the immunosuppression will be obviously immunosuppression now, but will be on immunosuppression post-transplant. So no. So there are certain kidney conditions that would be not an absolute contraindication to transplant, but can recur in transplantation. But lupus is not one of them.
I was offered once to whether I wanted to get psychological support with for my condition. I went to see a psychologist, but for me personally, I didn't feel like I needed it. I was quite okay with what I had at the moment, and I was just tried to adjust my life to it, and I try to read books about lupus. I joined Lupus UK, where they do have quite a lot of information about how to cope with your life while you have lupus. And I joined lupus group on Facebook. All of these helps quite a lot with my mindset as well. So, and my family is always there to support me with whenever I need it. So I didn't feel like I needed a psychologist. So, yeah.
I think it's a very good point, and certainly for any patient of any age, but certainly for the younger patients dealing with a chronic illness, that is a really vital part of their treatment. And I'm sure Dr. Nagra will touch on that in her talk shortly. But I mean, the two patients you've seen today have been, you know, exceptionally mature young individuals who have owned their illness, got on with life, done what they had to do. That's certainly not, you know, I wouldn't say that's the normal pattern necessarily. And you know, a lot of our focus in terms of managing patients is not just about the clinical illnesses, but it's about the psychological impact that illness might have on that individual, and offering support is, whether it's counselling, psychological support, is really, really important.
To add to that, it was fine at first, but when I got into university and when all these water weight was coming on, I did feel quite depressed at some stage. Not depressed, but I wasn't very happy about my appearance. I didn't want to go out. I didn't want to, being in uni, you know, you go out to a lot of night out and having drinks and everything, but I wasn't quite confident to do that. And I tell myself, oh, I really hated that I have this condition and having this appearance at the moment, but it's the condition I have, a condition I have to live with. So, yeah, I think I just try to live with it for the past years, yeah.
Any other questions? Okay, well, so if you could just join me by thanking our
Thank you.